platform Swiss Liver Patients Association, Swiss HIPAA. Today with the interview by Dr. Nadine Stanek, head physician at the Lucerne Cantonal Hospital on hemochromatosis or iron overload. Welcome, Dr. Stanek.
Thank you very much for having me here. I'm pleased to say some words about the hemochromatosis.
My first question, what is hemochromatosis?
Hemochromatosis is a genetic disorder. You have genetic alterations which lead to excessive iron absorption out of your intestine, and too much iron in your blood over a longer time can lead to iron overload of organs and even destroy your organs by too much iron.
Who is affected?
People with the genetic alterations or mutations are affected. Most usually we see it in the older men or younger men already, older women. And because it's a genetic disease, it's running in families. So this is important to know.
Who is at risk?
At risk are especially the people with double mutations. So if you get the gene alterations from your mother and your father, you are also at risk if you are a man, because they tend to get the earlier symptoms. You are at risk if you have Northern European roots. They have it more. And if you're in your family has it.
What are the symptoms?
The problem is the early symptoms are very unspecific. You feel a little tired. You do not feel so well at all. You may have joint pains, depressions, kind of these things. So very unspecific. And later on, if your organs are already suffering from iron overload, sometimes they lose their function. Sometimes you even only find it when there's already, for example, with the liver cirrhosis, and then you have the symptoms of the cirrhosis or of the organs affected or destroyed already.
How is the iron overload diagnosed?
Actually, I think you should be aware of it. So you should have your suspicions if you see the patients, for example, with the skin problems, or that you think of it when you are diagnosing a cirrhosis and you want to find out why. The hemochromatosis is running in families. You can do blood testing, the iron status. You can do the genetic testing in blood as well. You can do imaging, special imaging with MRI, with the liver series, or you can do liver biopsy, where you go inside and take a small side of liver tissue to explore it under microscope.
Mm-hmm. How is iron overload treated?
The treatment is basically to get the iron out of the blood by blood removal.
Mm-hmm.
So women treat themselves until they get to menopause.
Yep.
Otherwise, you should go to regular phlebotomy, it is called. So you go initially once a week to give some amount of blood, and then slowly you will reduce the iron content in your blood. If you cannot tolerate the blood taking on a regular basis, there's also drugs that can facilitate that you get the iron out of your body.
How can hemochromatosis be prevented?
The most important thing here is that you think of it, that you, if you have it running in the family, that you test the patients or the relatives before they have any disorders, any signs, any symptoms, and that you think of it early. Because if you start the early treatment, you will not have any damage, any problems of the organs by the iron.
Do you have any more information about hemochromatosis?
Here I would like to refer to my speech or to the short presentation. There in the sources at the end of the speech, there's listed some, as I think, more informative links in English language. I think you can understand it very well, even if you're not the specialist person.
As a specialist, do you have any recommendations or advices for patients with iron overload disease?
I think so what I would do in everyone is to get your heart checked. If you have the liver checked already, which is, I'm the liver specialist, so the liver is first, but then the heart. I think it is very important that if you get diagnosed with it, that you think of your family, that you think of that they should get checked, even if it's just the basic blood test with the iron studies. And I think that, and that's what I try to promote, that in every, especially older patients with liver cirrhosis, even if you think you know the reason, because it's very obvious, like you drink too much alcohol or anything, that every one patient with a liver cirrhosis, even if you think it's very obvious, that you just one time check it very seriously to know that there's no other additional reason for the cirrhosis, maybe one you could treat, or then maybe one who could be important for the children or the relatives.
Mm-hmm. Many thanks to Dr. Stanek for her understandable and helpful interview, which can an additional important source of information to patients. Thank you very much.
You're very welcome. Thank you.
Thank you.